Good morning. Hello, everyone. My name is Desire Manning, and today I will be discussing a group analyst for topic analyzing data, evaluating findings, and drawing conclusion for practice. I'll be walking you through data analysts, methods, key findings, and conclusions for each four articles we reviewed. So let's get started. And if you see me looking this way, my notes are on my iPad. So we're starting with Senegal. Um, Senegal is a title Kangaroo Mother's Care Improves Cardio, Respiratory, Physiological, and Preterm Infants. This was written in 2025. So the data analyst method is a quantitative, and as I'm scrolling right here, you can see all that I'm about to read highlighted. This was a prospective quasi-experiment observational study involving 50 preterm infants. The researchers used descriptive statistics and infantile statistics, including paired t-tests to compare cardiorespiratory cardiorespiratory measures such as oxygen desaturation and heart rate variability between incubator care and kangaroo mother care. The level of significance was less than 0.05. Key findings, which is all in here highlighted. Um, let's go down to it right here. Key findings were fewer oxygen saturations dip greater than or equal to 5% from 5% from baseline during KMC compared to incubator care. Median was 13 versus 24, and the probability was 0.001. Time with oxygen saturation was greater than, well, less than 90%, I'm sorry, was significantly reduced. 7.5% versus 2.7%. Probability was 0.04. SpO2 variability and heart rate fluctuations were significantly lower during KMC. No bradycardia events occurred during the KMC compared to 14% incident during incubator care. Probability 0.012. The conclusion of this was kangaroo mothers' care significantly improved cardiorespiratory stability in preterm infants on non-invasive support. The authors concluded that regular KMC can positively impact growth, neurodevelopment, and clinical outcomes, supporting broader implementation in NICU settings. Okay. And all that I said is highlighted right here in the blue, from the objective, the study design, the setting, main outcome, measures, results, conclusion. Moving on to the next one. So now this is Lazarus. This was written in 2024. This is inpatient skin to skin care predicts 12 months neurodevelopment outcomes in very preterm infants. The data analyst. So here we go. It's right here highlighted in red. The data analyst, this was a retrospective chart reviewed of 181 very preterm infants. The author all used a hierarchical linear regression to test whether skin-to-skin care rates predicted neurodevelopmental scores at 12 months. They controlled for gestational age, social economical status, health acuity, and visitation frequency, and 6 months development scores. They also conducted correlation tests and moderation analysis. The findings was skin-to-skin care rates was positively correlated with 12 months neurodevelopmental outcomes. The findings was 0.25 and the probability was 0.001. Skin-to-skin rate predicted 6.2% unique variance in neurodevelopmental scores at 12 months. A 20-minute increase in skin-to-skin care per day predicted a 10-point increase in developmental scores. These findings held even after adjusting for multiple co-founders and were statistically significant. Conclusion: increase in patient skin-to-skin care is associated with better neurodevelopment outcomes in very preterm infant at 12 months. The study supports skin-to-skin care as an evidence-based, family-centered intervention from improving long-term development. And that was the end of that one. Again, all my information that I said was highlighted in red. Moving on to the third one. We'll start right here. This is Hugginson. This was written in 2025. The title of this is Parental Singing During Kangaroo Care, Parents Experience in the NICU. So the data analyst methods was a qualitative. This qualitative study used semi-structured interviews and conducted a numerological hermeneutical analysis. The author used a two-phase approach, inductive content analysis to identify emergent themes, and deductive categorization within and Anton Vinsky sense of coherence framework focusing on manageability, comprehensibility, and meaningfulness. Key findings was manageability. Parents found that singing helped reduce stress and empowered them during NICU care. Comprehensibility, singing improved understanding of their infants' cues and enhanced communication. Meaningfulness, singing created emotional bonding and moments, enhancing family connection and identity. These experiences were profound in the intervention group supported by music therapies. Then the control group. I'm sorry. And here's how you see their methods, everything I just read, the introduction, their methods, and their results. On to their conclusion. The author concluded that parental singing, especially when supported by creative music therapy, enhance parents' infant bonding and fosters a stronger sense of coherence in parents. This contributes to emotional and well-being, attachment, and long-term family resilience during the NICU setting. During the NICU stays. On to the final one. So I have this highlighted in yellow. Make sure you can see. This is Val. This was written in 2023. This is a qualitative study. The title is Parental Options About Benefits of Kangaroo Care in the Neonatal Intensive Care Unit. The design was, and this is all on the first page, but in the introduction, but it wasn't highlighted. But the design was observational, exploratory, and descriptive with a qualitative approach. So the data analyst, which is in the part that I highlighted, was the semi-structured interview methods was used for data collection. Interviews were subjected to lexicorporeographical textual analysis using the software IRAMU TQ, spelled IRAMUTEQ, with descending hierarchical classification DHC and similarly analysis. Using DHC and similarly analysis in the IRAMUTQ software, a common tool in thematics textual analysis. The findings were are here. Well, they really start here and then they go down here, but as I'll tell you them, then I'll scroll because class one is here. Okay. So findings, class one, parent information about kangaroo care. Class two, which is down here. Reasons for parents to stop kangaroo care. Class three. Kangaroo care benefit for the parent-infant dyad. Class four. Bonding during kangaroo care. These are direct parent perspectives that shows the emotional bonding and practical impacts of kangaroo care. They are your qualitative themes and illustrative quotes. Now into your conclusion. What's the conclusion? Most parents showed some knowledge about kangaroo care. However, it was shown that this wasn't enough for maintaining kangaroo parents cites the presence of positive support and reassurance received by the nurses as important. This explains the main takeaways. Even with some awareness, nurse education and supports are essential for maintaining consistent kangaroo care. So that was my findings and my data analysts. Hope you guys enjoyed. Thank you.